I hope it will be fine because I have one screen behind another. So I hope I will be looking in the camera.
Okay, recording is running. Okay, so you can start.
Okay. I'm very pleased to meet Patrycja Calinska, the assistant to the board of Medicus at the Medicus Clinic in Wrocław in Poland. We want to talk about which preventive measures have been taken to avoid the spread of the coronavirus in this clinic. Good afternoon, Patrycja. Recent rumors say that the coronavirus may have entered Europe with a lady working at Charles de Gaulle Airport in Paris already in autumn last year. When did you become aware, or when did it come clear to you, the board and the lady director of the Medicus Clinic, that this was a pandemic and that you had to react spontaneously?
I suppose we weren't aware of the threat until late February, when the epidemic aggressively spread over northern Italy. Before, people were rearranging personal plans like trips to Asia, but when the virus appeared on such a scale in Europe, we realized that this is not a distant problem anymore. Around the 20th of February, where there were winter holidays in Poland and many people choose northern Italy as their skiing vacation, we started to prepare introducing the first preventive measures. Short interviews with patients who register for an appointment and those whose attendance was confirmed 24 hours before the scheduled visit. Our teleconsultants ask for symptoms and recent visit to countries with the highest contagion rate. Firstly, it was Italy, and then we added France, Spain, Germany, Austria, and Great Britain to the list.
What was the first step you took before you started any action to implement?
At the end of February, we drafted a plan which was preceded by many meetings of the board and the head of the clinic together with an epidemiologist. The initial plan evolved significantly since the first version, as we had to introduce more and more restrictive measures imposed by the Ministry of the Health and the National Sanitary Epidemiological Station, according to the dynamic situation in the disease spread control.
Okay, can you maybe list the most important measures you have taken for us?
There were many of them. At the end of February, instructions of proper hand washing were posted in every bathroom, and many stations with disinfection fluids were installed across the clinic. Posters issued by the Ministry of Health containing information on steps to be taken in case of suspicion of the disease were hung at different places in the building. A separate entrance was devoted only to patients with the suspicion of COVID-19. Medicus Clinic is not a place for public urgent care, but we still expected some patients with an unclear COVID-19 status. We had to provide safety to our medical staff and patients scheduled with planned surgeries. The children's area was closed and there was no +1 option. Patients were allowed into offices only separately, or with one caretaker for children and disabled people. Plexiglass screens were installed at the reception desk and also in doctors' offices. There was no possibility to use the clinic's parking lot, and visits at the patient's ward were suspended until further notice. Every patient registers for a doctor's appointment is interviewed for symptoms and recently visited countries. And there is an obligatory checkpoint for everybody entering the clinic, where the person's body temperature is measured. And all have to fill in the survey with contact data and declare not to show any coronavirus symptoms within the last 14 days. These procedures led to refusal of medical service several times. The building itself is equipped with an advanced ventilation system. The filtration and circulation of the air is now performed more often. Every 3 hours, the air in the clinic is exchanged 100%. Medical staff is provided with personal protective equipment and a special SARS-CoV-2 procedure developed in cooperation with an epidemiologist. Every employee had to confirm they were acquainted with the procedure. We also introduced teleappointments, of course, where it was possible.
Indeed, Patricia, a very, very long list of actions taken.
There's two times too.
Would you kindly share with us which were the most difficult preventive measures taken to implement? And maybe there was also some resistance from your own people to accept these preventive measures.
Actually, our employees were very cooperative and concerned about our general safety. We knew that all the elements must work concurrently to achieve success in this case. But one of the hardest things was to learn how to refuse our patients being provided with medical service if they were positive about symptoms or recent troubles. We made a big effort to gain their trust, and it took a lot of courage and perseverance to say no to them now when they are in need. It was clear to us, however, that this is the only path we must follow to continue running the clinic in the times of pandemic. Providing our employees with PPE was a big challenge too, as they were very expensive and in high demand right now. But in this case, there is no other choice than accepting the additional operating costs.
I understand. Now, talking about the patients, did you reduce the number of patients admitted to the clinic, or did the patients decide to postpone appointments because they were afraid of being infected?
Actually, when the lockdown started, most of our patients postponed their appointments. A situation like that never occurred before, and you can feel there is panic in the society. I suppose most countries were affected by the collective hysteria at the beginning. We could see people who were preparing themselves for the apocalypse. For more than a month, the number of patients was reduced significantly, and we decided to shorten our operating hours. However, we haven't stopped planned surgeries. The situation is slowly changing right now, and while all the preventive measures are maintained, the number of patients rises gradually.
Very interesting, and there is hope. Obviously, we are all on a very steep learning curve in this process. Is it possible, or tell us please, have you added new measures, or maybe have you eliminated some or reduced some of them during this whole process, because you realized some of the measures were very effective and maybe some were not as effective as you expected?
We were introducing new and more restricted preventive measures when the number of cases was increasing dynamically. That was the time for that. Now the situation is pretty stable, and except for one region with a rising curve of contagion, which reportedly might be locked, the number of new cases is declining, thankfully. And all of the actions taken by Medicus were synchronized with the recommendations and actions of the Ministry of Health and local authorities. Regarding the special type of the business and the very close distance to the patients, we'll probably stick to preventive measures for longer, especially as it is very hard to predict the further development of the situation. We are considering testing for coronavirus all patients admitted for planned surgeries, but the decision has not been made yet.
I see. Now, finally, I would like to know, do you see long-term effects on how the clinic will function in the future? And do you think we will be someday back to normal? Or do you suggest we will have to create a new normality?
So I'm pretty sure the whole situation will affect the world as a global society. and some of the market trends are reversed already. I feel like it is a matter of time when we see changes in our everyday life, and some of them will expect it, other will come as a surprise. The way we act, make decisions, prioritize things in life, spend our free time, have fun, I think they will all be affected. Regarding medical care, I think health professionals like specialists, nurses, paramedics will get more credit for risking their lives in everyday work. I suppose human relations will be more valued, and even though the epidemic proved to us that we have tools to use telehealth more often, we'll still seek the personal relationships with our doctors. At the same time, there is no doubt that the additional value of telehealth has been recognized by many more people and will be used much more widely in our new normality.
Thank you very much, Patricia, for this valuable view, personal view into the future. Thank you again for your time, and I wish you all the very best, the best to you, the best to your team, and of course to your patients. Thank you.
Thank you very much.
So, geschafft.